Sleep deprivation is serious. One cause is restless leg syndrome. For sufferers, it's a nightmare, the uncontrollable tingling, aching, or pain in the legs. Until recently, prescription medications were the only real option. Here to explain how that's changed, the principal investigator behind the clinical trial, Dr. Mark Bookfuhr. Good morning, sir.
Good morning.
Insomnia is a big issue. It seems like it's becoming an even greater one. Why is that, and what are the main concerns here?
Okay, well, insomnia is becoming more common, probably because we're too civilized and we keep our lights on and stay up late and watch TV and do all these things that are not good for sleep. And sleep is becoming insomnia is becoming an increasing problem for the Americans, with millions suffering. And what happens with this is they get increased fatigue, anxiety, and depression. It increases the risk for many other health problems, such as diabetes, heart disease, obesity, and high blood pressure. Now, the restless leg patients, which can be up to 10% of the adult population, have even more insomnia, so they're even more at risk for those associated health conditions.
How do you treat RLS?
Well, RLS so far has been treated with medications. And of course, the problem with medications is many patients don't want to take them, they get side effects, and they're not effective for everyone. And in fact, the two most commonly prescribed medications for restless legs tend to worsen the condition over time. Therefore, we're really happy to have the first FDA-approved non-drug treatment for restless legs, which is this Relaxis pad. And what this pad does is it provides a vibration. The patients put the pad under their legs, and when they get an attack while they're in bed, they turn the device on and it relieves the restless leg symptoms. So instead of having to rub their legs, get up and walk or move around, they can simply stay in bed and continue to sleep.
You said it's FDA approved, so that means clinically it's proven. What did you find as you were going through these trials?
What we found, we did 2 trials that the FDA used to approve the device, and we found that the Relaxis pad definitely improved the sleep of restless leg patients. And in fact, in my own practice, where I have a lot of restless leg patients, many of them have gotten very good relief of their symptoms and improved sleep by using the device.
And I imagine that a lot of them are talking about not having the side effects of those medications that they might have been taking before. Is that one of the benefits too? It's not just relieving the symptoms, but it's getting rid of some of that other stuff they didn't like about those other methods?
Exactly. Yeah, you know, many of the patients have already tried medications and have had trouble, or I don't have to tell you, anyone on a medication looks to see how they can get off the medication. Although the trials didn't look at this, from my own clinical experience, I have had patients who've been able to completely get off their medications and just use the Relaxis pad, which is great, because we all want to find non-pill, non-drug treatments for whatever we have.
And the website, I'm sure some of our viewers watching now are going to be curious about it. Where can they go online to learn more?
They can go to the company's website, which is myrelaxis.com, and they can get more information. They can even do a self-assessment test that will determine whether they have restless legs and whether they warrant treatment with this device.
Yeah, do it all online and then talk to your doctor after you're up to speed. To you, Dr. Bookfuhr, we appreciate you joining us today. I'm sorry?
Okay, you're very welcome.
Thank you.
I was just going to say, it is a prescription device, so you do have to talk to your doctor.
Yeah, you can't just walk into the pharmacy and pick one up. But you should be talking to your doctor anyway, so everybody's on the same page. Thank you again for joining us. We appreciate your time.
Okay, you're very welcome.
Mike, over to you.